our planning is first, check for doctor's order, review client's record for any known allergies or medical condition that would contraindicate use of drugs. Then gather all materials needed, wash hands, put on PPE if indicated, then follow the 10 rights of drug administration.
The purpose of eye medication is diagnostically eye drops can be used to anesthetize the eye. Take the medication to the client's room and place on a clean surface. Introduce yourself to the client, identify patient, check the patient's identification armband. Explain the procedure to the client, inquire if the client wants to instill medication. If so, assess the client's ability to do so. Wash hands, don gloves if needed. Place client in a supine position with the head slightly hyperextended. Next is remove cup from eye bottle and place cup on its side. Squeeze the prescribed amount of medication into the eyedropper. Place a tissue below the lower lid. With dominant hand, hold eyedropper 1/2 to 1/3 inch above the eyeball. Rest hand on the client forehead to stabilize. Place hand on cheekbone and expose lower conjunctival sac by pulling down on cheek. Instruct client to look up and drop prescribed number of drops into center of conjunctival sac. Instruct client to gently close eyes and move eyes briefly. Place fingers on either side of the client, nose to close the tear ducts and prevent the medication from draining out of the eye. Then remove gloves and wash hands. Record on the MAR the route, the site, which eye, and time administered.